Hey everyone, I'm your host Adrian. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Welcome to today's Rupa Live class presented by Rupa University, the best way to learn about specialty lab work from industry experts. My name is Adrian Martinez. I'm so excited to be back with y'all after taking a week off and being your host again this afternoon. Today, as I mentioned a moment ago, we have a very, very special guest in Dr. Geraldo Magarinos here to talk about the oral gut microbiome connection. Such an interesting and amazing topic. Before jumping in, a couple of quick housekeeping items to go over. Everyone joining will be muted by default, but if you do have any questions, don't fret. Go ahead and write them in using that Q&A button down in your menu bar, and we will host a live session with Dr. Geraldo at the end of the presentation. Immediately following the Q&A, yours truly will show you exactly how to order some of these tests on Rupa Health and navigate around the website. And if you have to jump early or maybe joined a little bit late, no worries at all. We are recording this session as we always do, and we'll make it accessible to you on rupauniversity.com, as well as send out a recording within the coming days. And finally, if you are a fan of this type of content, and speaking of Rupa University, be sure to check out rupauniversity.com to get access to all the previous sessions that we have done. So with that, let's jump in. I'd like to introduce Dr. Geraldo. Dr. Geraldo Magarinos, is a dentist from Chile who specializes in periodontics, oral medicine, and implantology. He decided to pursue his passion and become a board-certified naturopathic doctor in 2018 after more than a decade of conventional practice and university teaching. In addition, he specializes in integrative biology, dental medicine, homeopathy and live blood analysis, peptide therapy, and advanced clinical ozone therapy. Dr. Geraldo has long been a strong advocate of researching the human microbiome, believing that treating dysbiosis patients can prevent and even reverse numerous prevalent forms of chronic disease. He currently works for Microbiome Labs as a clinical consultant in microbiome analysis and is the co-founder and director of Revolution Gut Health, an online platform that offers coaching services to anyone wanting to learn about clinical protocols or trying to improve microbiome-related health conditions. Be sure to check it out. The website just launched. Thank you so much for joining us today, Dr. Geraldo. I will go ahead and let you take it from there.
My pleasure. Thank you so much for the invitation. I'm really excited to start this class today. This is a fascinating topic. It was probably one of the main things that got to my attention when I was working in the standard dentistry. And it was always the question why these diseases are chronic. And even with all the usage of antimicrobials or the things that were supposed to work, we were not able to regulate this for good, and they were persistent in people's mouth. And then later on, we saw that there was a correlation with other things going on in the body. So this got me started literally on the microbiome field. And right now, we have way more data available for connecting the dots. And I would like to briefly share all that information we have available for today. And I'm really happy to see everyone joining. And if you have any questions, of course, it will be my pleasure to help you out with any of those if I'm able to at the end of the class. So without further ado, let's start. So we're going to be talking today about the oral gut microbiome axis. Again, a fascinating topic. And I'd like to start with this phrase from Antoine de Saint-Exupéry, which is one of my favorite books that I read as a child, and says, in one part of the book says, what is essential is invisible to the eye. And at that time, of course, didn't make too much sense to me in the way it makes sense to me now for analyzing the microbiome, that invisible world that is so essential for human health and is now becoming so trending and important for treating the root causes of human disease. The oral cavity is the second largest niche in diversity for the human microbiota. After, of course, the gut. The gut will be the most diverse. It has more than 700 species of bacteria recognized there. Has a lot of types of them, microbes, including bacteria, fungi, viruses, protozoas. Has a lot of ecological niches, which they make a very complex habitat for all these microbes. We have different structures with different characteristics. And of course, they provide different types of ecological niches that will dictate what type of microbes we are colonizing those areas. And we are becoming more aware that besides being, of course, the initiation of the digestive process, right now, the oral microbiome is acknowledged as one of the crucial elements for maintaining systemic health, of course, oral health as well. But everything in the body that we are correlating regarding the microbiome has certain degree of relationship with the balanced status of the oral microbiome. And we're going to, of course, expand that way more on this presentation. So as I mentioned, we have approximately 700 species populating the mouth microbiome. We have a very complex composition. We have some that we already officially named, but there's still some types that we're cultivating, but they're not named yet, and some that still are in process of being researched. We have 12 main phylums that are recognized on the mouth microbiome: Firmicutes, Fusobacteria, Proteobacteria, Actinobacteria, Bacteroides, Chlamydia, etc. We have a big overlap between the mouth microbiome and the gut microbiome, and that actually is a very important consideration. We know that that overlap can create some cross references and relationships between those two ecosystems. They are actually intimately connected. And that overlap is due to a translocation effect that occurs naturally from mouth microbes to the gut microbes. So we know that that similarity comes from this passage of bacteria that we have normally from the mouth into the gut. And probably that also improves the communication pathways between those two ecosystems. I thought when I started studying the oral microbiome that this was going to be a hot mess, and it will be unpredictable in terms of the composition, because it's exposed. Every time we're speaking, every time we are eating, every time we're breathing, we are changing in a certain manner the composition of the ecological conditions and the composition of the microbiome of the mouth. Now, the reality is that there's way more stability in the microbiome composition of the mouth than I thought. And when I started doing research about it, I found that through a Spearman correlation, higher, the more stable, there were several areas on the mouth microbiome that were pretty stable. We can see here, for example, in this graph, that the tongue dorsum is actually pretty high for the Spearman correlation. Saliva also is another one that is pretty consistent. The hard palate, and there have even the supragingival plaque has a certain degree of high stability. So we can actually have some predictors, and we can do research on the mouth ecosystem, and we can have some consistency in what we're observing and the conclusions we can get out of the research that is being done. So that's actually pretty fascinating, because we have way more ability right now, knowing this, to evaluate the status of the microbiome in the different areas of the mouth. And we can correlate that to a certain degree of dysbiosis and how that is connected to certain systemic or local conditions. So that's something that it was actually a relief, because I thought initially, oh, this is not going to be able to be analyzed consistently. And now we know that is actually possible. Now, the mouth microbiome develops very intimately with gestation and, of course, the delivery passage. And we know that there's an early colonization in utero, and there are certain degrees of bacteria that can be transmitted to the mouth information through the amniotic fluid, and also, of course, by delivery method, especially if it's a vaginal delivery, we will get the early colonizers that will be colonizing the mouth, and then afterwards, they will be going downwards in the digestive tract and colonizing other areas. But the mouth will be probably one of the main initial areas that we see colonization through the birth canal. Of course, if we have a C-section baby or other things are not really in place in terms of natural colonization pathways, we're going to have a disruption in the patterns of the microflora in the mouth and, of course, everywhere else. Actually, there's an interesting study about the usage of pacifier, sustaining the relevance of the colonization and the early colonization of children, and also how we pass bacteria from the parents to that newborn or a child. And we can see that when parents were excessively cleaning or sterilizing the pacifiers, there's a more occurrence of asthma and other immune conditions. And when the parents were actually just leaving the pacifier alone, just putting that back again, or they were sucking the pacifier as a cleaning method, which is, I know, standardly completely contraindicated. When we see that pattern, we can actually see a drop in asthma, eczema, and other immunological conditions later on in their life. So that actually is telling us that the mouth microbiome expects to have this translocation of microbes from the parents to that child. And that's actually something that will improve the development of the immune system later on. So too clean, not so good for us. And that applies also for the gut microbiome. We know also that there's an important role of the oral bacteria in terms of breaking down certain nutrients, and the production of certain byproducts is related to the enzymatic activity of those bacteria. So keeping a good status of those mouth microbes over our lives, and especially, of course, in the early stages of our lives, is crucial for producing the things that are going to keep us healthy and alive. And we know that the passage of nitrates to the oral bacteria actually doesn't even come directly from the foods when we're chewing them. Actually, that happens through the stomach and then the intestines, reabsorbing those nitrates, and then they're flushed in the salivary glands, feeding the mouth microbiome, and then they have the chance for producing the much needed nitric oxide that is, of course, correlated with a healthy blood circulation. So there's also an intimate relationship that I will expand later on in the way we feed our microbes and how things are passed to the mouth microbes from the enteric circulation through the absorption of nutrients from the intestinal breakdown of the foods that we're eating. So the gut microbiome and the way that it breaks down nutrients and the modulation of changes and, of course, the feeding process of the mouth bacteria are intimately connected. They need each other. This is incredibly relevant, especially thinking how much dysbiotic conditions we have right now in the gut and how much prevalence of mouth diseases we have as well. And we are pretty aim or focused in fixing only one area at a time. And actually, that it doesn't make sense if we understand this communication process. We need to fix both to be able to improve any type of disease or condition that is occurring in anyone. There's actually a couple of studies. I think this is an area that we need to research more, but there's a couple of studies showing that the oral microorganisms are fed by the nutrients found on the saliva and crevicular fluid. And if we think about it, there's not too much time for the oral microbes to ferment or have contact with the foods we're eating. We chew pretty fast. Standardly, 30 seconds is the time that people chew their foods. And then we swallow. And if we're lucky, something might be left in the mouth. And we usually are pretty Most of the people who are standardly educated, they go right away and brush their teeth, and even more with some mouthwash or toothpaste. So there's not too much chances for the microbiome to get foods in that way. So if that was the case, and that was the way that our microbiome in the mouth gets fed, gets their nutrients, it will be very inconsistent. But the reality is that we get the nutrients from gut absorption, and then those nutrients already pre-digested, they come back to the salivary glands, and they're flushed into the mouth cavity. And now pre-digested, they're way easier to be utilized by the mouth microbes. And now we're feeding our microbiome in the mouth more consistent. But of course, that creates the connection between the mouth and the gut microbiome in a very strong way. And if the the gut microbiome is not doing its job, if it's imbalanced, or we have poor digestive efficiency, that directly is going to affect the way we're feeding our mouth microorganisms. So in that sense, we can think about the correlation between the occurrence of dysbiotic patterns of the mouth microbiome and the poor digestive process or the lack of nutrient intake on the gut microbiome area. So this is something that definitely needs to be studied way more. We need more data here, but we already see some connections, and I think they're pretty consistent. And if we keep studying this, I definitely believe that we're going to find more and more evidence supporting this statement. Now, when we talk about the oral and gut microbiome connection, we're talking how these microbes are talking and correlating to each other. And there's, of course, a symbiotic, healthy way they connect, but also, unfortunately, there's an imbalanced dysbiotic connection, and that can lead to inflammatory immune problems and other diseases created in other areas of the body. There's actually, this is a really nice image illustrating multiple types of conditions that can be triggered or even aggravated by colonization of certain oral microbes in other areas of the body. And we know that there's consistent data for Alzheimer's disease. Periodontitis, when it's established, can actually create other issues in the body, including cardiovascular disease, can complicate more diabetes and other metabolic disorders. We know that cystic fibrosis, even some cancerous process are associated with the occurrence or the presence of microbes that are correlated with the mouth, not the gut. But when they get translocated to the gut area, they can trigger inflammatory conditions that will develop later on of all these type of diseases. So because of the anatomical position that the mouth has and the way it connects to everything else, this is the entry point. This is where everything is received. And if we think about the microbiome as a communication system, this is the first person who is opening the envelope and reading the letter. And then this information is passed to the gut microbiome, and of course, then is spread, or it will trigger other responses everywhere else in the body. But initially, it's going to be read and interpreted by the mouth microbiome. And that makes the mouth microbiome incredibly important for preventing or even improving certain systemic conditions we see very frequently, unfortunately. So we know dysbiosis in the mouth is clearly linked to a number of local systemic diseases. Again, there's quite a few journals talking about this, and I will keep mentioning more data we have available about this topic. Now, the way we create these inflammatory triggers and probably the common denominator in terms of creation of these diseases is by the stimulation of the immune system directly or indirectly. Directly will be the translocation of microbes from the mouth cavity and through the stomach acid into the intestinal area mostly. That's where most of the diseases are created, when we have an imbalance on the mouth microbiome, and that those microbes are translocated into the gut microbiome. Now, the associated factor for that to happen is that you have to have a low stomach acid production. Hypochlorhydria is necessary for having a significant translocation of those microbes from the mouth into the gut. So the fact that hypochlorhydria has to be present makes a lot of people think, well, but that shouldn't be that common. Unfortunately, between all the vagus nerve imbalances we have due to stressors, all the pollutants that are highly occurring in our modern world, and we're talking about glyphosate and other pesticides, we're talking about heavy metals, we're talking about other forms of pollution, including mycotoxins. All those environmental toxins or pollutants are actually quite disruptive for the digestive efficiency, and they will lower the capabilities for producing stomach acid. Of course, emotional stressors, psychological stressors, which unfortunately also are very trending, also they play a role in imbalancing the vagus nerve, the autonomic nervous system, and then lowering the capabilities for producing stomach acid and creating hypochlorhydria. And also associated to that is antibiotic use. Antibiotic use has been correlated with a lowering on the mitochondrial count inside the human cells. And of course, places which are highly demanding in terms of energy production, and that includes, of course, the stomach area and the stomach acid production, they will be compromised. Now, metabolically speaking, they're not going to be as efficient as they should, and that can compromise the production of hydrochloric acid. Another factor, of course, will be the foods we're eating. If they're processed and they don't have the right nutrients included in those foods, we will not properly stimulate the digestive system, and that can actually affect the production of hydrochloric acid. So there are multiple causes for this to happen. So it's way more prevalent than what we think in terms of the population that can be experiencing this type of issues. And of course, that will highly increase the risk of translocation of microbes from the mouth into the gut. We of course, it was obvious to say, but anyway, we'll mention it, that the hydrochloric acid and the pH of that fluid is a very important filter for preventing the translocation of those microbes, unless, of course, they are spore-forming, but usually spore-forming agents in usage of the probiotics or from soil-based probiotics, they tend to have a regulatory activity on the gut. So for most of the cases, they can actually be beneficial. But there are many of the mouth microbes which are not spore-forming agents that they can cause a lot of damage. Now, the other way will be through the cytokines. When we have a dysbiotic mouth, that also will trigger localized immune responses, and that will elevate the cytokine buildup that is formed by the immunological responses to counteract the overgrowth of certain opportunistic bacteria. And of course, the overuse of antimicrobials and other things that are detrimental for the mouth microbiome, and that includes also usage of metals and other types of dental procedures, those are going to imbalance the mouth microbiome, and they will create more immunological responses, more release of cytokines. Those cytokines can travel through the bloodstream and then create other inflammatory triggers in different places of the body. And we see that associated with metabolic disorders, for example, the diabetes and cardiovascular disease, and has been heavily correlated, those two conditions, to periodontal disease especially. And periodontal disease is used as a very good marker for studying all these connections because it's chronic. And the standard treatments, usually they don't resolved from the root cause, the periodontal disease. So because it's chronic, it can be studied for long term, and we can make all these associations. Now, there's a direct association between inflammatory bowel disease and the oral microbes. And this is due to the same phenomenon I was explaining before. We produce a lot of saliva. We produce 1 liter of saliva every day, approximately. And that actually, of course, is passed to the intestinal tract. So with that saliva comes a lot of microbes. We pass billions of microbes every day. And those microbes in homeostasis, they do play a very important role in modulating proper changes and passing proper information to the gut microbiome. And then, of course, the immune system receives that information. This is the entry point of information. The environmental conditions are passed from the mouth microbes inside our bodies, and then they are analyzed and, of course, passed to the immune system through the gut bacteria. But this is, like I said before, this is the first place when you open the envelope and read the letter, then you pass that information to the gut. So from that standpoint, we have to be very careful about what we're passing. And when we have a dysbiotic condition, those microbes can actually pass erroneous information and trigger inflammatory conditions. And we have seen in recent studies a correlation between the oral microbes that we're passing to the GI tract and IBD. So, for example, if you have a dysbiotic mouth microbiome and you have periodontal pathogens present in high amounts, for example, Porphyromonas gingivalis and Fusobacterium nucleatum, which are pretty prevalent pathogens for periodontal disease, then we will see that there's an increase in the destruction of the intestinal barrier. It's going to be more endotoxemia on the digestive tract. And of course, it's going to be an increased systemic inflammatory response. And that could be the initiation and progression of IBD. When we talk about translocation, I'm using, of course, frequently metagenomic analysis for analyzing the gut microbiome. And I see multiple types of patterns. And as I mentioned before, when we see things like Fusobacteria highly elevated on the analysis, and we see elevated numbers of Proteobacteria, which also are very present on the mouth microbiome, or Firmicutes and Actinobacteria, when we see these patterns, everything is consistently elevated. And all these elevations are actually from the overlapping groups that can colonize both the gut and the mouth microbiome, and start getting suspicious. I always say that. It's too much coincidence to just be a coincidence. And of course, a huge red flag, seeing Fusobacteria highly detected on the stool sample analysis. And if we go to more in detail analysis and we start looking at people's gut, and this is a real report, and you start seeing things like Fusobacteria, Enterobacteriaceae, Ectroelaceae, all these families. Bifidobacteriaceae will be another one, Veillonella, Erisilobacteriaceae, all these in high abundance. All these families are way more abundant on the mouth microbiome than the gut microbiome. And therefore, a consistent elevation in all these overlapping groups, it will be a very good risk predictor that we're actually experiencing translocation from the mouth microbiome to the gut microbiome. So I can't say definitively, yes, this is happening just by looking at these markers, but at least makes me suspicious. So whenever you're using any type of gut microbiome analysis, be attentive to these groups that we recognize as oral microbiome, and see if they're present in the gut and if they're overabundant. I mean, if you have many of them detected and all of them elevated in numbers, you might be early detecting a risk factor for creating all these conditions that we're looking at right now, and the ones I will be mentioning in a minute. So I think that understanding metagenomic analysis, this is Biome Effects, by the way, from Microbiome Labs. It's performed by Cosmos ID, but is sold by Microbiome Labs. But any testing that is good enough and is doing a metagenomic analysis with full sequencing of the DNA will show this type of microbes, and it can be correlated to a certain extent to this translocation phenomenon. So we know that people with IBD actually have a different flora, and this is significant, the changes from healthy people, and that we have certain groups, including Streptococcus, Prevotella, Neisseria, Haemophilus, and Bayonella, show a couple of already there in that person that was analyzed. And when those are more prevalent, more abundant, we can see changes also in the inflammatory status of the gut and leading to IBD. Now, the liver and the gut are incredibly connected. There's a couple of beautiful lectures I saw earlier recently regarding the gut-liver axis. But also we know that the mouth microbiome, because everything is connected, not think for a second that any area of the body is not connected to the other areas through the microbiome. The skin microbiome, we can connect the dots in so many ways. But the gut microbiome has a very direct influence on the liver condition. And the mouth microbiome will influence through the gut liver systemic conditions. Actually, we know that people with liver cancer, they have a different type of microflora in the mouth than healthy people. And this is significant, of course, to be associated. And so when they analyze the tongue flora of patients with liver cancer, they see a very significant difference in the colonization patterns. And remember that I showed before through a Spearman correlation that is a very stable place. So it can be analyzed and it can be correlated and compared from one person to another. And also we have data showing that when a person has periodontitis, that can become a risk factor for non-alcoholic fatty liver development. So we know there is an inflammatory condition in the liver cells created by translocation and the input of certain microbes that are coming from the mouth when the mouth is also in balance. Now, going back to my previous statement, if we have digestive issues or our diet is not good enough, or we have other associated risk factors, and we're imbalancing the mouth microbiome through the poor input of nutrients that is supposed to be coming from the gut, then we're circling everything. So we have poor digestion, poor nutrient intake, poor recirculation of nutrients, poor feeding processes for the oral microbiome, alteration in the oral composition, and these dysbiotic bacteria now, they're traveling back to the gut, and now they're triggering inflammatory conditions. That alone could be a huge game changer in the way we see the initiation and the progression of pretty much any chronic disease we know. Now, there's even more data. There's patients with liver cirrhosis, and they found that there's a large number of oral microorganisms found in the intestinal microbiome, proving that the gut dysbiosis related to translocation of mouth microbes can also have other implications in affecting organs like the liver. And even more, we have specific microbes, like, for P. gingivalis, Porphyromonas gingivalis, which is not even an advanced colonizer for periodontal disease. It's actually more present in gingivitis than periodontitis. So, and that alone can change the composition of the intestinal microbiome, increasing permeability, and that leading to the spread of endotoxins that are coming into the liver and then increasing certain inflammatory markers, like, for example, triglycerides. Another very important factor is the oral microbiome and the development of cancerous process. And there's a lot of evidence right now showing that the oral microbiome can influence the tumor proliferation and the invasion and metastasis even. So it can start the tumoral process, or it can make it more severe. And we know that the cytokines released by dysbiotic bacteria from the mouth can actually promote tumor formation that can actually be seen on oral cancers. So squamous cancer in the mouth can actually be associated with dysbiotic microbes on the mouth, and there's a lot of evidence about it. And actually, I put a paper here that is the conclusion is that that oral squamous cancer can actually can have a complete different type of microflora in the mouth than a person with normal tissues and a healthy mouth. So there's a change in the pattern on the composition of the mouth microbiome when there's a development of an oral cancer in this case. And we see the correlation, and this is highly correlated. This is not a weak correlation. This is a very strong association. So there's evidence to support at least that there's a certain degree of connection between the types of microbes we have in the mouth and the initiation of tumoral process on the mouth. And that is, I think, is absolutely significant. Actually, this picture, which is taken from the same paper, is showing the changes in terms of the presence of certain microbes. And we see that there are certain mouth microbes that are lowered and they're considered healthy. And other ones we associate with periodontal disease or even more abundant in root canals. And those connected to each other and all these pathways can actually create a domino effect that will trigger the cancer progression. So definitely the mouth microbiome has direct and indirect pathways for triggering tumoral processes. And this is, again, I think it's very important to acknowledge, because if we are on the preventative side and we go to the dentist, most of us in a regular basis, these connections, they're supposed to be a must in terms of analysis and early detection. And we have to stop, this is my belief, we have to stop this separation between different areas of medicine. We need to start communicating more, because all this is relevant for everything else in the body. And if we have somebody who is looking frequently the mouth and can detect inflammatory conditions there, that's something that is highly relevant for preventing multiple other systemic conditions later on. So I believe the mouth and the mouth analysis is a fundamental piece of the health analysis of everyone. The other thing I mentioned is about the oral microbiome and the cardiovascular diseases. And we know that periodontal disease bacteria can actually affect the body's immunity, and they definitely are pro-inflammatory and creating interleukins and anti-NFA alpha and those molecules can enter the blood circulation and start damaging other areas of the body. And that especially is true for vascular endothelial damage. And that can lead to arteriosclerotic plaques, which of course will lead to other forms of disease in the cardiovascular system. And that has been highly proved. This is very acknowledged. Now, the studies were showing that the severity of the periodontitis can also influence other areas of the body. And in this case, they're looking at Alzheimer's disease. And they saw that the more severe periodontitis was, the cognition level was dropping. And if people were missing teeth because of the severity of that periodontal disease, Alzheimer's progression was getting worse and worse. There's also a correlation between the degree of alveolar bone done in other research and cognitive impairment. So we know that localized inflammatory conditions and dysbiotic bacteria on the mouth can influence cognitive disorders, And in this case, Alzheimer's disease has been heavily correlated. The speculations or the way they explain this mechanism is through the same pathways that are affecting the cardiovascular system through pro-inflammatory cytokines. And the other thing is just the way that there's ways that periodontal microorganisms can actually go through the central nervous system, crossing the blood-brain barrier and creating inflammation locally on certain ganglia. The mechanisms are still in study, but there's a lot of evidence showing that this could be true. And of course, it will explain, or at least will put another factor to consider in the treatment of Alzheimer's disease. We know, by the way, that lipopolysaccharides, endotoxemia on the gut also is heavily related to Alzheimer's. So everything, again, is connected. There's even more connection between the mouth and the gut, and now this is through the alveolar bone. And we know that gut pathogens can actually translocate to the bone. Now, this is the opposite direction, and they can actually create dysregulation on the bone homeostasis. We know that microorganisms or even the toxic molecules created by those microorganisms that are leaking through the gut membranes can travel and affect the mouth tissues, and especially when we're talking about periodontal disease. And we know lipopolysaccharides, when we have high levels of them, and they're traveling through the enteric circulation, they can actually affect in a negative way the balance and the status of periodontal tissues in the mouth. And I stole this image from Microbiome Labs. Sorry, Kieran. This is just a very simple, but yet very, very nice picture explaining the way that lipopolysaccharides can be binded by antigens, but also they can leak inside the body and trigger inflammatory responses. And when that happens through circulation, they can travel to different parts of the body. So we know that endotoxemia from leaky gut can actually trigger inflammatory mechanisms in periodontal disease. And we know also that oral microbes can trigger inflammatory conditions on the gut. So this is actually circling all the time. And that is why it's very hard for me, at least, to see a separation between those two niches. Of course, for study purposes, we separate those areas, and there are certain differences, of course, in the composition and the ecological conditions in both areas. But in terms of the connection and the things that can be created, and especially from the stimulation of the immune system side, I think that this is only one big community of microbes distributed around the GI tract, and that is getting influence back and forth from these different phenomena and different alterations, and triggering immune responses that can be detrimental for everywhere else in the body. Now we know that there's a lot of things that can be correlated in terms of human health and the oral microbiome. But what affects the oral microbiome to become dysbiotic? There's one paradigm that I want to discuss today briefly, and that's the oral hygiene. And we know, cosmetically speaking, everyone wants to brush their teeth and have this really beautiful white smile, and I understand that. Of course, that's socially important. But the main issue is what type of damage we're creating to the microbes living there that justifies this cosmetic goal. And there's plenty of studies, I will show you just a couple of them, that they correlate the antiseptic mouthwash and, for example, the nitric oxide pathways and the increase in hospital mortality. And what these researchers, they conclude that the antiseptic mouthwashes are associated with mortality in hospitalized patients. And this is because there's a disturbance in the nitric oxide homeostasis. And because we're killing microbes that are making this nitric oxide that is highly needed for cardiovascular health. And when we start killing those microbes on a frequent basis, we neglect those pathways. And therefore, we're deficient in nitric oxide production, and we increase the risk of high blood pressure and other conditions on the cardiovascular system. And if that patient is already compromised, we're talking about hospitalized patients, that will increase the risk for mortality. And I think that's absolutely relevant for considering the status of and how we take care of the mouth microbiome. L-arginine, which is an amino acid, an essential amino acid that is incredibly important for the anti-hypertensive effects through, again, the nitric oxide pathways, also is inhibited by the destruction of the microbes coming from a very commonly used mouthwash, which in this case is chlorhexidine. Now, the other factor that is associated with dysbiotic mouth microbes is mouth breathing. And there's a lot of people right now which are not aware that they're mouth breathers because they do it on a subconscious way. And some snore, and somebody, if they have someone on the side, might complain and they will acknowledge that. Sometimes that doesn't happen with snoring and they just don't know. And by mouth breathing, you actually change salivary markers and the microflora. So there's a study here showing that the salivary markers and the microflora in late adolescents mouth breathers, it was changed, and the plaque level index was increased. And also there was a higher risk of develop higher levels of streptococcus mutans, which we know it could be one of the causative agents of tooth decay. So those people were actually higher in their risk for getting tooth cavities just because they were mouth breathers. And that is telling us, and that probably is the tip of the iceberg, that the way we breathe actually is correlated with the patterns of the composition of the mouth microbiome. More studies, the same thing, the conclusions that they found here, that when comparing all the data, they can see that mouth breathing predisposed patients to an increase in periodontal disease susceptibility, and a noticeable increase in periodontal indices and bacterial colonization. So we know now, not only for tooth decay, we know that for periodontal disease, we have higher risk markers when we're mouth breathing. So this is another thing that we definitely need to assess in order to keep good condition on the mouth ecosystem, and of course, creating a balance in the mouth microbiome. There are certain solutions that are being promoted, for example, mouth taping for this. I think this is a very easy solution for some people. I don't think it's the solution for everyone, but for people that can actually get benefit, it will be actually a pretty simplistic approach for improving this and keeping the mouth closed whenever it's supposed to, because that actually will create a certain condition, environmental condition that is needed for the normal growth and balance of the mouth microbiome. There's a commercial brand that is called Somnifix, but also you can use surgical tape, and YouTube is loaded with videos explaining how to do this. So if you have a concern, you can check them out. When we talk about microbiome, I know we always think about probiotics, and I do use probiotics pretty frequently when I see patients. That there are certain ones that they are proven to be very effective for pretty much everyone in this world. And I will mention the ones I like the most. And of course, we're talking about gut probiotics. In this case, we're going to be talking about oral probiotics, but gut probiotics are needed for treating the mouth. I think that we already established the connection between the gut and the mouth. So if you want to have a balanced, healthy mouth microbiome, you need to address the mouth. Now, when I talk about microbes with a purpose, is that we have research and data available showing that these microbes are beneficial and they're consistent in providing benefits to the gut. And there's a lot of endospores out there, and I have some that are usually my favorites, and they have been very effective for improving pretty much everyone's microbiome in the gut. I use 3 labs. My favorite one, or the one I use the most, is actually Microbiome Labs, not because I worked for them. I actually found them because I was using them. It was the opposite. And because the data that they have available for the improvements that they were creating on the gut was pretty consistent. And also because I know that after the age of 3, when you stop the balancing on initial colonization process of the gut microbiome and you develop an adult microbiome, then you need to just modulate what you already have. And that actually is the role of the endospores. And the endospores, they were supposed to come from the soil, but we're not getting soil in the foods anymore. So I think that we need to mimic the process in a certain degree by using endospores that come right now isolated in a probiotic. So this company makes something that's called Make Us Probiotic, has 5 different types of endospores, and all of them, they have different benefits. But also I use in combination sometimes another probiotic, which is also excellent, which is called Biotic Quest Sugar Shift, that also has different types of microbes. Also, they have added benefits. So actually, there's nothing wrong with combining all this. And there's also plenty of research about these strains and species that promote a lot of benefits to the gut environment, to the gut microbiome. And there's a last one that I've been using pretty recently, but has 2 types of endospores, which are actually pretty unique. And also they come from the soil, and they have very important benefits for the gut terrain. And that's Terra Flora, the Daily Care. So just leaving you this information available for anyone which is curious what I do recommend on a frequent basis in terms of probiotics to improve the gut microbiome status. And the last one, actually, Saccharomyces boulardii, I think that's is a game changer, helps so much for lowering the inflammation on the gut. I absolutely love it. And it's pretty naive. It's well tolerated by pretty much everyone, and also has functions in, for example, lowering or eradicating other opportunistic fungi, and it's transient. It doesn't stay on the gut; it just does what it needs to do and leaves. So that's actually what I'm expecting from a fungal probiotic. Now, what happens with the oral probiotics? Unfortunately, I don't have too much. I don't have exciting information about them. They're coming in the market. They have been in the market available pretty recently. So these are not products that we have for a long time, that therefore the research about them is pretty scarce. It's not so abundant as the gut probiotics. And also the other problem is that oral probiotics, they have way more challenges in terms of colonization and becoming stable on the mouth microbiome than gut probiotics. So we know there are certain species that are used on probiotics that they can be beneficial. Again, the studies that they have been doing for oral probiotics are not long-term studies. We don't see really very exciting data yet, but there are certain benefits that were reported by using oral probiotics in these short-term studies that I'm mentioning. These are the species that are the ones that are mostly used in the standard formulations, and they seem to have a beneficial effect for the oral microbiome. Now, like I mentioned before, the studies mostly they last for 2 to 4 weeks, so they're very short. I think that needs to be studied for a longer term. There's some cavity development that they have done research about for a little bit longer, but still, I think that we're on diapers in terms of analyzing the efficiency and the benefits of using oral probiotics. And definitely we need oral probiotics that are delivered orally, so in a chewable form. It doesn't make any sense to try to put oral probiotics in the gut because the likelihood that they're going to be surviving the stomach acid and traveling somewhere else is not very high. So they have to be chewable. Another important factor is diet. Here, this will be a very long conversation, but mainly we know that the quality of the foods we're eating will have a direct impact on the way we feed our oral microbes. So we need to be consistent in terms of what we eat, because we're going to be feeding our mouth microbiome as well, not only our gut microbiome. So, of course, quality, the way we source the foods and how we process the foods internally is very important for being consistent in the way we feed our microbiome and the oral microbiome. So general recommendations for improving the mouth microbiome: avoid over cleansing. I'm not saying not to brush your teeth or not to have certain degree of cleaning protocol, but do not overdo it. I think once a day, toothbrushing is fine if we do it consciously. Interproximal brushing is also important. Antimicrobials agents in any form, they should be avoided for all the reasons I just mentioned. If you have, or you're suspecting you have mouth breathing problems, go to a specialist and check for that. That definitely can be a huge game changer, not only for the mouth microbiome, for many, many other things in your health. And of course, lifestyle exercise has been proven to be very effective in terms of improving the microbiome everywhere. So the mouth microbiome is not an exception. Exercising is a must for everyone that wants to be healthy. If you have something in your mouth that was placed before, or somebody suggesting, hey, you can get a mercury filling or metals, avoid it. And if you have them already, safely remove it. Because if you just take it out without the necessary cautions and the methods that are established for preventing the swallowing or any other type of absorption of those metals, you can get heavily polluted, and that will raise significantly your toxic load. Biological dentists are my favorites. I'm one. So if you want to check your mouth, please go to somebody who has a certification in biological dentistry. I think that understanding safe ways for treating the mouth is crucial for keeping your mouth microbiome healthy. And of course, take care of your diet. As I mentioned before, what you eat will feed you and your microbiome at the same time. So to finalize, relationship between the structure and function of the oral microbes and the balance of human health and disease is definitely becoming more clear right now. And we know that as part of the human microbiome, the oral microbiome is it has a systemic and community-specific effect, and that we're studying and correlating more and more over the years. Compared to the gut microbiome, though, we have way less amount of studies, and definitely we need to improve that to make proper correlations and take action in the right way. And the understanding of the mechanisms that are used for maintaining and regulating the oral microecological balance right now is becoming more and more clear that is very significant for preventing and treating oral diseases, and also preventing and treating human systemic diseases. So that was it. Thank you for everyone who attended. It was, again, a pleasure being today here. This is my information. There's a QR code that you can use for connecting with me. That's all my contact information. And that's my website and my email. If anyone wants to talk to me afterwards, it will be my pleasure. I always love to connect.
Dr. Geraldo, thank you so much. We had a ton of questions flowing in at the end, and so super excited to jump in, and we'll try to get through as many as we can. And we're going to go chronologically here, but the first question that we asked was, what was the source of the gut-liver axis lectures that you mentioned recently seeing, if you can recall?
I have the research. Actually, the research is in the slides. I don't recall by heart. I don't recall the names, unfortunately, but I think I there's plenty of research, by the way. There's not only one or two, but I mentioned the ones that I thought were most relevant in connecting the dots. Also, there's some lectures that you mentioned. I think that was a question or not. The lectures, I can send it over if you want. They're on YouTube, and if you type on YouTube "gut liver axis," probably you will see the lectures I'm mentioning. They're both the ones I know. They both come from Microbiome Labs, from their keynotes, but also there's a couple of ones that I haven't checked yet from other podcasts, and also they seem to be very informative.
Perfect. And yeah, just to reiterate, we did record this. So if anybody did join late, we will send out the recording along with the slides as well. So next question we have is, do you recommend xylitol mouthwash? And are there any mouth care products that you like for children?
No, xylitol has an effect on avoiding the buildup of biofilms. And biofilms is a huge topic, but we know that the common narrative has been demonizing biofilms. Biofilms is the fundamental structure for making whatever you want to make from the microbiome standpoint. So you need them. The only thing that you have to care about is providing nutrients and the right environment for those biofilms to become friendly, because they can be also very aggressive if they're not happy. I can put it that way. But if you take care of your terrain, nutrient-wise, lifestyle, and everything else we mentioned, your biofilms will become benign and very, very, very beneficial for your health. Yeah. So xylitol, unfortunately, avoids the binding of those biofilms to the surface of certain structures, including the mouth cavity, and that will have probably a negative impact if we are trying to improve our microbiome in the mouth and not disrupt it.
Perfect. Thank you for that response. Are there any dental care products that you recommend? And I know that you talked about dental side in a moment ago, but what dental care products do you recommend, if any? Of course you are.
Yeah, I mean, I do. I like the best one is probably a soft toothbrush. I know it's not doesn't look exciting, but that actually might be probably the most potent tool. You have to remove plaque. You don't want to remove biofilms. You just want to remove the excess amount of foods and things that can be actually not so beneficial for you. But in terms of intense cleaning, I know it sounds simple, but I do recommend a 1-on-1 ratio of mix between coconut oil and a little bit of baking soda. I just do a paste with that.
Interesting.
That seems to be a very, very effective and also very biocompatible toothpaste for most of us. And you have certain properties for taking care of your mouth without being disruptive. I avoid essential oils. I avoid antimicrobials. Anything that can also have some whitening effect can be abrasive. I also tend to avoid it. So most of the toothpaste that you will see up there, they do have one or more of those ingredients. Fluoride for me is 100% no. It's toxic in any way you look at it. Yeah. Mouthwashes, I don't see the value of those. If anything, water is just enough. And we have to be careful though, because if we're washing our mouth with water and our water is contaminated, which is actually true for a lot of places in the country. Mm-hmm. I don't know abroad, but at least in the United States, also it can be a source of pollutants for the mouth that can be affecting the microbiome.
Interesting. And even diving a little bit deeper, I know that this was a common thing that we're seeing coming in with questions, and I think even just more so curiosity too. What are your thoughts on just the standard getting your teeth cleaned every 6 months, flossing, after every meal, multiple times a day, brushing your teeth, so on and so forth? I guess, what are your thoughts on that?
I mean, again, everything with moderation. I think that if you have calcified plaque and you need to remove that. Right. That's not going to be good for you, because it can create localized inflammation. I mean, that exists. Even though we make all the connections with the mouth microbiome, the gut microbiome, still we can have some localized factors that will promote inflammation. So I will remove that 100%. Over cleansing or just going there for cosmetic purposes because I have a couple of stains and going through a full mouth cleansing frequently can also have detrimental effects for your microbiome and for your tooth structures. So you want to take care of the microbiome and their ecological niches. So both are connected. Right. You're going to grow only depending on what environment you're creating. So for that reason, I think, again, there's a value on that. I'm not saying they should be avoided, just common sense. I think that's the key word there.
Absolutely. Yeah, like you said, everything in moderation.
Yeah.
The next question is, any advice for CPAP users to keep the mouth microbiome healthy? Special cleaning of the hoses, heating hoses for more moisture delivery to the oral cavity, things of that nature.
Yeah, that's true. That's a very specific condition. So of course needs more specific care. I think, yes, in that case, moisturizers are needed. We need to keep a certain degree of moist that also will allow the mobilization of nutrients inside the mouth. So yes, I think that on those cases, we need to take a little bit more actions or in terms of improving the ecological conditions on the mouth to maintain the normal pH and moist and everything else that is needed for the maintenance of the oral microbiome.
Perfect. Are spore biotics safe for all ages, including children?
Well, I will say above the age of 2, you can use them pretty safely. Below that age, I will say that it's a more specific conversation with your physician. They're needed. Some people, they report they use them from 6-month-old and above without any problems. But I will say safely, you can start using them starting the age of 2.
I'm just writing this one here. Is there any evidence of mouth pooling with oils supporting the oral microbiome?
It's not consistent. There's a lot of advices out there in terms of the miraculous properties of oil pulling. The evidence doesn't show those exciting reports. The actual research that has been done, even though it's an ancient type of protocol, actually comes from Ayurvedic medicine, like thousands of years ago, there is some benefits. But it's not the ultimate solution for any dysbiotic condition on the mouth. It can be an add-on in terms of the whole protocol that you might be establishing for rebalancing your mouth microbiome. But again, don't put your whole faith in that because the evidence is not pretty consistent. And I do believe personally that there's benefits on using oil pulling, but again, not as a huge game changer as it's being promoted.
Yeah, that makes sense. Absolutely. Everyone wants to hype up, if it's there.
Of course.
100%. Would you recommend against even herbal antimicrobial products like biocidin, liposomal mouth rinse, and toothpaste?
No. I am fundamentally against antimicrobials. And I've used antimicrobials a couple of times in, let's say, in 1,000 patients, or I don't know, I rarely recommend them. Biocidin is a very, very strong antimicrobial. I've seen reports doing metagenomic analysis before and after using biocidin for a time frame of a month, and you can have a super huge impact in lowering diversity with using biocidin. And again, this is nothing personal. That's nothing against the company. I know the intention is good behind their products, but unfortunately, it is an antimicrobial, and it will lower diversity, alpha, beta, and it will affect the communities of the microbiome. And we know that the result afterwards is more virulence factors, more aggressive patterns in the composition of the microbiome, and a reoccurrence of the initial factors that were creating the problem. And if you think about a modulatory effect of the microbes over the immune system, the results you will see from antimicrobial use will come mostly because we're suppressing the communication and therefore the expression of the immune system in terms of buildup of cytokines. So the symptoms will go away magically because, oh yeah, the immune system is not doing much because the immune system needs the input of the microbiome to respond properly. So that's why we see improvements. And later on, we see all this coming back again. So again, I'm not saying for every single case, antimicrobials are not useful. There's some exemptions, but for most of the cases, I try to avoid them.
Yep, absolutely. Last few questions. This practitioner has a gold crown molar, gold crown on a molar. Should they get it removed or changed?
And sell it.
Yeah, melt that down.
Actually, legally, dentists, they have to give you back a crown that is made of gold. Yeah, it's yours. Gold has been probably the most biocompatible material. Actually, everything that is being tested in terms of safety standards and is compared to gold. Gold is literally the gold standard.
Yeah.
But usually gold is not only gold. It's something else below that, in between. And it can get corrosive and it can get damaging. So I will say the most important thing is evaluating that with a dentist and seeing that the adjustment and everything else around the periodontal tissues seems to be fine. And of course, the tooth itself, the structure seems to be stable. If that's the case, you might be willing to keep it. If you're going to remove it, as any metal removal, it needs to be done with the proper isolation and protective measures, because if not, you will swallow or breathe those metals, and you don't want.
Makes sense. Thank you. So if you are going to get it removed, make sure that your dentist gives it back to you. What are your thoughts on red or blue light therapy mouth appliances to help with inflammation or whitening?
Good question. I don't have too many thoughts about it because I don't have too much evidence about it. And I know there's some. I have not really dived deeper into that. I think that light therapy in general can be very beneficial for treating inflammation. I logically see benefits there.
Right.
Specifically, what changes can be created on the microbiome in the mouth? Not sure. I can't answer that properly. I don't have that info.
Expanding a little bit on those, what are your thoughts on the at-home teeth whitening? They have those gels and you have to keep the gels within the forms in your teeth. Do you have any thoughts on those?
Yeah, no, they're, I'm sorry for my friends that are using them. They're horrible. That they're going to make your teeth structure porous. They have a pretty significant amount of chemicals there. And I don't see a way that that's going to be safe for your microbiome. Okay. Yes, we can think about recolonization afterwards. Maybe nothing really wrong will happen if it was used for a very short period of time. But still, those are chemicals. Those are quite aggressive for the structure. So again, maybe with an individual assessment, some people will tolerate it. I don't know because I'm not aware of any study being done on the changes on the microbiome using peroxide or any other type of bleaching agent in the mouth. Of course, the common sense tells me it's not going to be a good thing.
Yeah, so, just putting peroxide and bleaching agent in the mouth, not good.
I've seen people that use bleaching agents and without the proper assessment, they ended up with root canals in every anterior teeth.
Oh no!
So yeah, we see some very severe, very dramatic situations after bleaching treatments. And again, I'm not saying, oh yes, you're going to have a huge imbalance because of that. I can't say that, but just my common sense tells me try to avoid them if possible.
Right, and if you are potentially going to get a personal assessment first.
Yes.
Yeah. Last couple questions we have is what are your thoughts on the use of water picks as flossing devices?
They can be useful, but not with tap water.
Okay.
Tap water has chlorine.
Yep.
And millions of other things.
Yes.
You go EWG, reported water, scary thing there. Like I found that actually where I live, there was uranium reported in the water. How come? Like, where do you get uranium?
Right.
So,
yeah.
But just chlorine alone is a microbiome disruptor. So, and fluoride, which is another thing that they add to the tap of water. So, if you're going to use water, use distilled water or any other type of treated water that is clean, doesn't have any of those pollutants.
Gotcha. And I know you mentioned soft bristles. Thoughts on electric toothbrushes?
There's some new ones that are actually more less aggressive for the mouth structures. The initial ones were a drill. They were like you see the mouth shaking. Like they were very intense for the gingival tissues. And now there's a couple of brands. I know Oral-B is the one I remember, but there might be more that they're making more soft, more biocompatible type of electric toothbrushes. And again, the same rule applies in terms of toothbrushing. Don't overdo it. Just be conscious about it. When it's needed, again, not so frequently that you will be disrupting your microbiome all the time. You have to allow a certain degree of time frame for recolonization and reestablishing the normal patterns on the microflora.
Yep, makes sense. And then the last question we have time for today. And again, folks, I appreciate you all sticking around. We have over half the people that were able to stick around for this Q&A. So I think it really shows the impact and interest in this topic. Any recommendations for people who take amoxicillin for dental visits due to artificial heart valves?
Yes, the evidence is actually pretty weak there. Has been actually debunked that there's absolutely no benefits in taking preventive antimicrobials for when people have any problems in their valves, in the cardiovascular valves. And so I will say that it actually is ultimately a decision between your physician and you. But what the evidence shows is that there's actually no strong protection for any occurrence of infection after a dental procedure by taking amoxicillin prior to the visit. That's what the latest research shows. But I know was so strongly input in the medical and dental community that it's very hard to take away that concept. But this is what evidence shows. And that I do believe it. And I don't think that antimicrobials will actually help. Actually, if anything, knowing the ways that the microbiome and the immune system communicates, it might actually affect in a negative way the way your body defends itself from any type of abnormal colonization or immunological issue.
Makes sense. Dr. Geraldo, it's been a pleasure. Thank you so much for joining us. Any final thoughts? And then again, if you want to share that slide where people can find you, that would be great. Yeah, do you have any final thoughts for the folks who are sticking around?
Yeah, no, I'm again very grateful for everyone who attended. I'm available for any questions afterwards. And I believe this is the tip of the iceberg, that this will be probably one of the most trending areas of knowledge in the next 5 years. So I think that this is something we have to be looking at constantly. Mm-hmm. And hopefully we're going to be seeing more and more evidence and research to give more clues about how we can take care of our health based on the oral microbiome. And I would love to be on the top of that. So yeah, any way you want, if you want to connect with me, is again my absolute pleasure.
Amazing. Thank you so much again. This has been a fantastic presentation. I know that we're going to get a ton of people asking for the recording. So again, we did record this. We'll go ahead and share that out within the coming days once we've had the opportunity to do some edits to it. But from here, we're going to do a quick transition. I'm going to hop over to Rupa Health and show you how you can order some of the tests that Dr. Geraldo was mentioning previously during the presentation from Microbiome, among other organizations. So I'm going to go ahead and steal the screen share, and you can stick around, Dr. Geraldo, or you're welcome to hop off, but we so much appreciate you spending some time with us today. But with that, y'all, thanks for sticking around. And for those of you who don't know who I am, my name is Adrian Martinez. I'm the head of practitioner partnerships here at Rupa Health. My job, beyond just hosting these webinars with fantastic practitioners, is to speak with practitioners about Rupa Health, who we are, what we do, and why do we host these educational webinars on a weekly basis. Well, Rupa Health is a functional medicine lab platform. We are designed to basically make life easier when it comes to ordering tests, managing tests, handling the patient experience, essentially taking away a lot of the pain points that can be associated with lab testing. Most practitioners order from multiple labs, right? Maybe you have a test that you order your stool test from, or a lab that you order your stool test from, your hair tests from, your breath tests from, your urine tests, so on and so forth, right? And that within itself, managing multiple different accounts, or even just setting up those different accounts, can take time, right? Going to each individual account to place your orders, manage your results, not to even mention the patient experience and the time that it can take handling all the support associated with the tests, coordinating phlebotomies. And, if a specimen issue happens, that can take up a lot of time. So what we do here at Rupa is bring everything all under one roof, making it streamlined, and so allowing you to order from over 30 different labs in a matter of seconds. It's free to sign up for, and I'll show you exactly how to do all that in the next 5 minutes, if you can bear with me. So this is the Rupa Health dashboard. The first thing I'm going to show you is just how simple it is to place an order on Rupa Health. All we need is 3 bits of information. We need the patient's first name, last name, and email address. We will collect everything else directly from the patient to complete the order. That way, you don't have to have the patient's whole file on hand. We will make it as simple for you as we can. This is the order screen. You can do things like setting up custom bundles. Custom bundles are sets of tests, sets of blood panels, and a combination of tests from any lab that you want to work with. So if you want to put a bundle together from multiple different labs, you can go ahead and have that. One click, all those tests will be added into your cart straight away. Below that, you can create a favorites list. So individual tests from labs that you commonly order, you can put a heart next to it. And so when you're ready to order a test, it appears right here within your favorites list at the top. And so I can order that Biome Effects from Microbiome, but maybe I want to order an organic acids test or a hormone test, right, from Dutch. I can go ahead and add those into my cart, 3 tests from 3 different labs straight away. When I'm ready to order, I just go ahead and click send to patient. And that's how I'm able to order from over 3,000 different tests from over 30 different labs within a matter of seconds. It's that simple. Once you go ahead and press send on that order, we will reach out to the patients. We'll handle billing if you want us to handle billing. The alternative is you pay for the test yourself and then handle billing separately with the patient. We'll drop ship the kits to the patients. So you don't have to stock any kits in office. We'll go ahead and send those kits directly to the patients. We'll follow up with them to send over instructions, FAQs. We can help coordinate phlebotomy. We'll handle any support questions that they have. Our compliance rates are above 85%. We'll follow up with them, and then you are notified as the results come in, which you'll be able to check all within one single location. This is what it looks like. So we'll reach out to the patients. Again, if you want us to handle billing, one less thing on your plate, we will do that directly with your patients. A really unique thing about Rupa Health is that we understand that these tests are, unfortunately at this moment, primarily cash pay. And maybe it's not even unfortunately, maybe you don't like insurance. I don't think really anybody likes insurance directly, but if you don't want to handle insurance, don't worry about that. But we offered multiple different payment solutions to your patients. So not only can we pay with these tests for cash and credit, but we can also accept HSA, we can accept FSA, and we can also set up a 3-month interest-free payment plan with your patients to pay for the cost of these tests. Making that more accessible for your patients is our goal here, as our mission is to bring root cause medicine to the world. From there, we'll highlight all the different payment options, as well as the tests ordered for them, any costs associated to that. If you pay for the tests, we will go ahead and not show any pricing to the patients, but we will still take care of the entire patient experience. Nothing changes except for our communications regarding pricing. From there, we'll send over instructions and FAQs to them, walking them through how to take each test, as well as fill out the requisition forms. And if they have any questions, they reach out to our team. We are a human team here at Rupa Health. What I mean by that is when your patients reach out to us, they're not going to get a chat bot that they have to go through a ton of different options to get their best resource and answer. They will get contacted by an actual person on the other side, helping them out to provide the best possible patient experience, because we understand not only how important that is for the patient, but also for your business as well as our business. Our instructions are not only comprehensive, but they're also very user-friendly. From there, we will follow up, and then you're alerted as each individual result comes in. You just hop right back into your main Rupa Health dashboard, and you're able to view and track all of your orders straight away. I can hop in and see, hey, what's the status of each of the tests that I ordered, 4 different tests from 4 different labs, when those sample arrived at the lab, so you can follow up with those patients, schedule those next steps. When the results are in, you're able to just hop right in here. You can download them. You can schedule a clinical consultation. So if you do need some assistance interpreting the results, you can schedule time with a clinician from the lab that you're ordering from to go over those results, as well as you can even send them to your patients through us as well. So everything all in one place without having to go to each individual lab portal to track the status of your orders, as well as view your results. Now, I'm sure you're curious, what does this all cost? Nothing's ever free. And of course, this isn't completely free. We as a business have to earn a little bit of revenue, right? And so our pricing is very transparent. We charge wholesale practitioner pricing. So what that means is the same price that you would get having an account directly with the labs is the same price that you're getting here at Rupa Health. The way that we generate our revenue is simple. We charge a 7% processing and ordering fee on each order, and that's paid for by whoever pays for the tests. So if you're having us manage billing directly with the patients, then your patients will be the one paying that service fee, that 7%. In that scenario, Rupa is free for you. The only time you would ever pay anything to Rupa Health is if you decide to pay for the costs yourself of the tests, and then you can bill the patient separately outside of our platform. If you're having us manage billing each order with the patient, then you'll never pay anything to Rupa, and that's the beauty of our platform. Now, while I understand you may be saying, hey, my patient may be paying a little bit extra here, let's look at that. Let's look at that cost. Let's break that down. So if you as a practitioner were to be referring your patient to pay for these tests directly to the labs, your patients will be paying $830, $829. Because we're providing your patients with that practitioner price, they're actually saving $260. So when you're taking into account that $40 service fee, we're still actually saving your patients well over $200 by working directly through Rupa Health. So that's where the big cost savings comes into play, is we can potentially not only be saving your patients hundreds of dollars on each order, we can also be saving you a lot of time handling a lot of these oftentimes manual tasks like patient support, like follow-ups, like specimen issues, right? As well as putting everything all under one roof will allow you as a practitioner to work more effectively, gain time back to see more patients and build your business. At the end of the day, that's what we want to do. We want to service as many patients as we can while making your life easier. And beyond just somewhere where you can come and order all your tests in one place, as you're seeing right now, we do a lot of education as well. So not only can you come and learn about these tests through these webinars, we also have boot camps, which are paid opportunities. This is the only other paid option here at Rupa Health. 6-week deep dives. You see, we have one coming up with Cyrex with Dr. Jeffrey Bland. Fantastic. As well as another one with Lyme with Dr. Jaquel Patterson. So we have boot camps. We have live classes on each of the tests. You have access to them all within a single library. We have a magazine. We have a podcast. So a ton of fantastic articles here, as well as since we are in the unique position to be working with so many labs, we offer you the ability to compare different tests, diving deep into seeing what works best for your business. But if you do have any questions, I would love to get in contact with you. I'm going to put up my information real quick, and then I'm going to jump in to see if there are any questions that came in through the chat. But that was my quick 5-minute spiel on Rupa Health, who we are, what we do, why we do what we do. And really to summarize it, we're a functional medicine lab platform that's designed to make your life easier when it comes to lab testing. If you have any questions, don't hesitate to reach out. My name is Adrian. I'm the head of practitioner partnerships here at Rupa Health. Here's my phone number as well as my email address. Super simple. It's just my first name at rupahealth.com, ADRIAN at rupahealth.com. Let's hop into the chat to see if there are any questions. Nope, just sharing a lot of love. I appreciate you all so much for joining it. This education stuff is what really inspires me. It's my favorite part of the job. don't tell anybody that, but it is my favorite part of the job, is hopping on and getting to see how inspired a lot of the practitioners are to continue to learn about this ever growing field. Functional medicine is near and dear to my heart. And what you'll come to find is, if you are working with Rupa Health and our team here at Rupa, functional medicine is near and dear to all of us. We take it all very personally. So if, again, you do have any questions, feel free to reach out to me. More than happy to hop on a call, schedule a Zoom, whatever you need, let me know. Thanks so much for joining.